Dear students, in today's class, I would like to thank all of you for the overwhelming support that you had been giving me for the past 1 year. Touchwood, my first class has found 1,000 viewers. The class was atherosclerosis. Also, I would like to reinforce that the book that you find behind me, the so-called tips, topics in pathology for students, has also found an immense support in the university questions. And the rarest of rare questions, such as obesity, even I was a little worried, but then it had found 3 full pages in this book. Students are students, and always do remember, IQ is equal to UQ. R.A.T.S in pathology, which means racing against time for students in pathology. And my class for the undergraduates shall continue. Incidentally, I have crossed 200 classes, R.A.T.S and game put together. The topic for the day is thrombosis. I would like to bring to your mind that whatever we have omitted is our university question. At this juncture, I have found that I have omitted a few topics which shall be again brought into the framework of our classes. One being thrombosis, 1. Thrombosis 2, carrying out the morphological changes have been well sketched in an earlier class. I shall be slow and deliberate. Let us start with the terms. Definitions are definitions. The first one is hemostasis. It is not homeostasis. Hemostasis is the maintenance of a clot-free state of blood in a normal intact blood vessel. Whenever there is a rupture of the blood vessel, there is a plug that is formed, which is called the hemostatic plug. In today's class, we are more worried about the terms clot and thrombus. These are nouns. Clotting and thrombosis are processes. Clotting is a process of coagulation of blood in vitro. It can be in a test tube or outside the blood vessel itself. Whereas thrombosis is the coagulation of blood in an intact blood vessel, and the component formed is called the thrombus. For example, in this one, I am finding an intact blood vessel within which a clot is being formed. There are various reasons, we shall be going to them later on. But please do understand this. This is called a thrombus. Whereas, when you collect a sample and leave it for some time, it undergoes a clot and the serum gets separated. This is what we do in our laboratories. On the contrary, when there is an anticoagulant and it is being centrifuged, you get the RBCs, buffy coat, and the plasma. Plasma minus fibrin is equal to serum. The coagulation cascade. This is a basic physiology topic. It would have been covered for you people in pathology and also in hematology. I would like you people to kindly pay your attention to this diagram, which is one of the most simplified forms. There are 2 pathways. One is called the intrinsic pathway within the body. Another is extrinsic pathway from outside. And whenever there is a damage, there is an element called tissue factor which gets exposed. The tissue factor, by means of factor 7, is converted to factor 10. And from now onwards is a common pathway. The test that can be done at this juncture is a prothrombin time. The intrinsic pathway, on the other hand, is composed of a cascade of events. The inactive form is converted into an active form. So you people should remember this: 12 to 12A, 11 to 11A, 9 to 9A, 8 will be there, which helps in the conversion to factor 10. And here APTT will be the test of choice. And from 10, you get prothrombin is converted to thrombin, and this is helped by means of factor 5, which is called a Labelle factor, otherwise calcium and lipids. In the question paper, I was a little surprised to see that factors such as calcium, APTT, etc. were being asked as questions. And in all of us, you find that there is a thrombin and a fibrinogen being formed day in and day out. But it undergoes a lysis and the clot is removed. So there is a fibrin clot. Ultimately, it is being removed by means of a process called as fibrinolysis. Look at this one. Fibrinogen is getting converted to fibrin. And what happens is there is another process called as plasminogen to plasmin. And this helps in the degradation of the fibrin to fibrin degradation products. This will again precipitate a thrombin. So this is a vicious cycle that is going on. In today's world, this fibrin degradation product and the D-dimer test are of paramount importance in diagnosing the viral diseases and disseminated intravascular coagulations. There are also certain inhibitors of thrombosis, namely antithrombin, protein kinase C and S. So these two flow diagrams, I would like you people to kindly memorize. It will pave way for a very strong foundation. Now comes the hallmark. The father of pathology, Rudolf Virchow, and his triad, Virchow's triad. This can be asked as a viva, and even otherwise in thrombosis, we shall, and will have to mention this. It is composed of an endothelial injury. There is also either a stasis or a turbulent blood flow. Third one is hypercoagulability of the blood. There are three such elements, and hence it is called a triad. And when all of them are put together or one is in action, there can be the formation or a predisposal to a thrombus formation. So this is called Virchow's triad. V is pronounced as F, and the father of pathology is a German in origin. Now look at this one. There are some analogous beautiful pictures that are given side by side. In our normal blood, you find that this is the pattern of flow. This is called a laminar flow. When you see a plywood, you will be finding parallel lines, and that is called a laminated appearance. A laminated appearance we can see in a hydrated cyst also. So you find that there is no disturbance at all, and the cells are all flowing as though they are soldiers in a regiment. The smaller cells, such as the platelets and the lymphocytes, will be taking the axial flow, whereas the larger cells also will be slightly away, but nothing will be touching the endothelium. So this is a layered flow called the laminar flow. And look at this one. There is absolutely no disturbance. There are roads and then I think tourists, and they are all enjoying the scenario. This is a laminar flow in a river. Stupid mnemonics are our favorites. Thanks to nurses and the medicos for having provided these two mnemonics. You people can take whichever you like. Virchow's triad, VARCHOW. V for vascular trauma, that is endothelial injury. I for increased coagulability. R for reduced blood flow or stasis. So this is 1. And for the medicos, this can be 1. Best. B for blood hypercoagulability, E for endothelial injury, S for stasis, and T for turbulence of blood flow. Stupid mnemonics, please do remember, they will save us. Now, what are the factors affecting hemostasis? Just follow what I say. It can be the blood vessel wall, that is the endothelium. It can be the platelets. It can be a coagulation pathway, or it can be a fibrinolytic pathway. All these are normally present in us. And sometimes we have a prothrombotic state, and sometimes we have an antithrombotic state. Prothrombotic is whenever there is an endothelial dysfunction, or sometimes an underlying disease such as atherosclerosis. Finally, these can lead to thrombosis. This is just an idea. There is also something called as antithrombotic state. Antithrombosis means in normal individuals, this is there. There is a healthy endothelium. We can otherwise call it as normal intact endothelium. Vasodilators such as prostaglandin and nitrous oxide. No platelet aggregation. If you take our blood, the platelets will not be aggregated. There is no thrombosis and a normal blood flow continues. Look at the beautiful balance that we have got within our vasculature. Look at the pictures on the screen. Earlier, I had shown you a picture of a quiet river. And now there is some kind of a fall. Even then, I find that all the layers of water are parallel to each other. This is a classical laminar flow. One does not disturb the other. Whereas in this case, we cannot make out anything. There is a lot of turbulence, havoc, almost like a gush of blood, and as though a dam is being opened. And look at the flow over here. They know no direction at all. And water always finds its pathway of least resistance. So this is another one. Why am I saying this? So we shall always follow a step-by-step approach. This is a vessel wall. We have got the endothelium. Then there is a lamina propria or a loose connective tissue. Then the bundle of smooth muscles. In this case, there has been a rupture in the endothelium, a denudation. And I find that a platelet that is almost harmless over here, it develops a tendency to get attached to the subendothelial collagen. This is classical. In fact, your Robin says that they are oppositely charged, as a result of which they get attracted and the platelet gets adhered to. Addition is the first one. Once there is an addition, it attracts more and more platelets, and this is called as aggregation. And there are the various factors. We shall be coming back to them. You people shall draw this diagram, or at least this. This is a schematic picture of the same. A rupture in the endothelium, and you find that it is not that outside there is a clot, within. So there are the activated platelets, and there is a fibrin meshwork that is happening. If it is going to be happening inside the lumen, we call it a thrombus. Look at this, again a schematic one. This can be superimposed on the morphology of the thrombus in topics such as atherosclerosis, etc. There is a rupture of the atheromatous plaque. This is the lumen, and this is the atheromatous plaque, an elevated lesion. And in that there has been an area of hemorrhage. And there is a blood vessel which is bursting out. That is what we are seeing. And ultimately you find that it is filled with a clot. It can be occlusive thrombus, or sometimes it can fragment, leading to embolization. We shall have this in mind and proceed to the next slide. And what will happen whenever there is going to be a thrombotic occlusion? This is exactly what is happening. A beautiful angiographic picture depicting the cause for an infarct of the digits over here. These areas are completely vascularized, whereas there is non-vascularization in this thanks to the occlusion somewhere over here. And look at the development of gangrene of the extremities, the digits. This picture, normally as I had been mentioning earlier, there is always a balance of the hemostasis. So there is coagulation, there is fibrinolysis, but always it is balanced. When there is a deficit of the coagulation, it leads to bleeding. When it is more of it, it leads to thrombosis. Similarly, when there is a deficit of the fibrinolysis, it can lead to thrombosis, or an excess of it can lead to bleeding. Please do remember a beautiful, reproducible schematic picture. I would like you people to kindly identify the different ones. So this is more of hydronomics, and I think an engineer will be a better person to explain than me. So here I find that it is more or less calm. There is probably an unruffled water, a laminar flow. Gradually there is some kind of a ruffle that is happening over here. And though there is some amount of lamination, here it is becoming turbid. Is it clear? So I would like you to find that there are different such phases in our own vascular flow. Altered blood flow. The first thing that we spoke of was endothelial injury. The second one is altered blood flow. This can happen in a case of stasis or in a case of turbulence. Stasis means what? Whenever there is going to be a clot or something, stagnation, varicose veins, for example. Turbulence, whenever there is a narrowing of a valvular outlet, stenosis, hypertension, aneurysms of the blood vessels, atherosclerosis. Obviously, these will disrupt the laminar flow. Venous disorders such as varicosities, sickle cell anemia, hyperviscosity, or polycythemia. My professor used to call them as hyperdynamic circulation, Professor M.S. Ramachandran. A for anemia, B for beriberi, C for cirrhosis, D for ductus arteriosus, E for exercise, emotion, G for Graves' disease, H for hypertension, I for increased infusion of fluids, and so on it will go on. So please do write a note of this. All this can cause altered blood flow. And this is a ventricle showing a large thrombus. We shall come to the morphology of it later on. And look at this, a laminar flow, and then there is a stenosis or something. This is getting disrupted. Here it twists on itself. This is called as eddying. So look at this. There is a beautiful flow over here. A rock or something is lying. It is getting diverted. And then there is an eddying of the currents. This can lead to more of the endothelial damage, more of the exposure of the collagen, and the formation of a thrombus. Please do remember, these line diagrams are superb. I would like you people to kindly draw them. Thrombotic and antithrombotic factors. No other go but to memorize. Quite easy. There are only two components that we should remember. One is the endothelium, another is the platelet. First one is the endothelium, in which I mentioned the thrombotic, prothrombotic, or the procoagulant factors. And these are the list of factors I would like you people to kindly memorize. Von Willebrand's factor, tissue factor, plasminogen activator, etc. by the endothelium. So this is one. Second one is antithrombotic factors or anticoagulant factors. Prostacyclin, nitrous oxide, antiplatelet antibodies. Heparin, which is used therapeutically. Thrombomodulin, which is important. And there is also something called as fibrinolysis. Once there is a thrombus that is formed, there is lysis and there is production of the fibrin degradation products, tissue plasminogen activator. So this particular diagram, please do remember, you will have to by heart. If you have got it difficult or it is boring, look at this one. So in this, I am finding two faces of the same personality. and that is the endothelium. Your Robbins describes it as a case of a schizophrenic cell. Schizophrenia means there is a dual personality within the same person. It happens at the cellular level also. The same endothelial cell happens to be procoagulant as well as anticoagulant. Hence the term a schizophrenic cell. It has got a double role to play. And please do remember, I hope you people can recollect the movie from R.A.T.S and the artist behind. The role of the platelets. In the platelets, these are the things. What is the mediator over here and what is the effect that is being formed? So there is the von Willebrand's factor leading to platelet addition, ADP thrombexin, which leads to aggregation of the platelets, alpha granules, which are selectin addition molecules and platelet factor 4, and dense bodies, which are calcium, histamine, and serotonin, all of which helps in the activation, addition, and the aggregation of the platelets. There is also another factor, B is platelets. Third one is the clotting cascade, which you had mentioned earlier. There are some conditions where there can be hyperclotting, some there can be clotting deficiencies. And finally, the fibrinolytic mechanisms. So very easy for us to remember. 1 is endothelium, 2 is platelets, 3 is clotting factor, 4 is fibrinolytic mechanism. And in my class on platelets and thrombocytopenia, I would like you people to kindly go back to it. It is a little difficult, but both go hand in hand. And these are the thrombotic factors, schematic diagram from my book, 1 page. So these are the platelet effects. This is a normal von Willebrand's factor. What happens is when it is getting exposed, it is usually subendothelial in location. When it is getting exposed, it leads to the addition of the platelets, and this leads to further aggregation of the platelets. They are well being knitted by the thrombi or the fibrin strands that we are seeing. Also, there is an activation of the tissue factors which can lead to anti-fibrinolytic effects. So please do remember this. These are all thrombotic factors. And when I say thrombotic, there has to be an antithrombotic factor as well. This is what we mentioned, heparin-like molecule, protein C, activated protein C, thrombin, thrombomodulin. These things you people will have to remember. Antithrombin, these are all antithrombotic factors. Prostaglandin nitrous oxide. So kindly remember this. It is a simple diagram and worth remembering because thrombosis by itself is a difficult topic. What are the morphological types of thrombi, or rather the types of thrombi? It can be cardiac thrombi, arterial thrombi, capillary thrombi, and venous thrombi. Cardiac, it happens in large capacious chamber. That is what I had shown you people earlier. I will also be showing you another picture of it. Arterial thrombi, it can happen in the aorta, particularly in an aneurysm. This, for instance, is an aneurysm of the aorta, and I am finding alternate dark and light lines. These are the lines of Zahn. Coronary artery, cerebral artery, renal artery. In the capillaries, in the case of disseminated intravascular coagulation. And this is what is happening in the case of the endothelium. This is a normal endothelium. There is a rupture of it. This is from my book, 1 page, and I have shown it in the von Willebrand's disease as well. So there is an exposure of the von Willebrand's factor. The platelets get adhered to, adhesion first. Later on, they lead to collection of these platelets, which is called aggregation. Again, the von Willebrand's factor is useful. So these are the series of events, very easy for you people to remember. Certain diagrams are repetitive for us to understand. And coming to the causes of endothelial injury, there is one. Heart myocardial infarction, infective endocarditis, rheumatic heart disease, congenital heart diseases. Arteries, atherosclerosis, and vasculitis. Capillaries, in an earlier picture, I had mentioned disseminated intravascular coagulation. And this is it. This is a case of disseminated intravascular coagulation. Trousers sign. He was a person who diagnosed his own malignancy by seeing this migratory thrombophlebitis, a feature of disseminated intravascular coagulation. And what are the causes of hypercoagulability? It can be genetic. Some people are prone for it, or it can be secondary. It can be cardiac failure. It can be traumatic. So these are the things. And this is a triad over here. Again, endothelial injury, alteration in the blood flow, hypercoagulability within the blood. So simple diagrams, easier for us to remember. This is what I said. So this is called a mural thrombus. I'm finding dark red lines and pale yellow lines. So there are red lines and pale white lines. This is called a mural thrombus or a coralline thrombus. It looks like a coral reef. And this happens usually in large capacious chambers such as the ventricles or aneurysms of the aorta. Now look at this one. This is the left ventricle. There must have been an infarction over here, and there is a thrombus that is formed within. And the types of thrombi, this I had not mentioned earlier. The fourth one is the venous. So it can be arterial, it can be capillary, it can be heart, or it can be venous. And when I say venous, the varicose veins, worm-like veins. Pulmonary veins, superior vena cava, inferior vena cava. Hepatic vein is another one. And that is what I'm seeing over here. So this is the hepatic veins that is getting formed, and they are all draining into the inferior vena cava, wherein there are multiple thrombi that are being formed, which is classical of the Budd-Chiari syndrome in the liver. This is the varicose vein. So I hope you people will be able to explain all these things. Recollect, try to explain. The human mind can make a hell out of heaven or a heaven out of hell. Look at the vast difference between the two. And many a time I find that our minds are almost akin to this. Smooth and laminar, turbulent and restless. Au revoir.